Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this world absolutely nuts when they hear me say it, I am the host of this show, Yer Big Dog, Luke Robinson. And here again with this week, our co-pilot, our trusty co-host, Ginger Morgan. She's the executive director of the Puppy Up Foundation. Ginger, how are you?
I am doing well, and I'm really excited, if one can be excited, to talk about cancer, but I'm excited to hear all about lymphoma today.
That's right. It's the start of season 2, and this season we're going to have specific episodes on canine cancers, different types. We'll talk about the breeds affected, the standard of care, prognoses, and so on and so forth. So on that note, that was a perfect segue. We have a very special guest from the Colorado State University with us today to speak about lymphoma and mast cell tumors as well. Her name is Dr. Kristen Weishaar. How are you? Welcome to Fuzzybutts and Friends.
I'm doing very well. Thank you so much for having me today. I'm really excited to be here.
Yes, it's exciting. Colorado State University, I've got a lot of history with that, a lot of memories. My second Fuzzybutt I lost to cancer, Murphy, was a patient there, and Colorado State University, Dr. Withrow, Dr. Venable, the whole team took exceptional care of him. So I love CSU for sure. So we like to begin our podcast, Kristen, Dr. Weishaar, with your origin story. So tell us, how did you get you start your beginning into veterinary medicine and medical oncology?
Sure. Starting at the very beginning, I'm originally from the Central Coast of California. Moved around quite a bit when I was younger, but really just always had an interest in science and certainly a love for animals. For a couple of years, I was, going a little crazy thinking I might actually want to be a human physician, and then realized that probably wasn't the best idea, and went back to my roots wanting to do veterinary medicine. And actually, the reason for my interest in oncology started sort of in my junior year of undergrad when I was diagnosed with 2 malignant brain tumors, and so went through surgery and radiation treatment, and really kind of got exposed to that. And interesting, I was 20 years old when I was diagnosed, but the type of tumors that I had were more pediatric tumors. So I was actually treated at Children's Hospital in Boston and had radiation at their facility at the Brigham, and worked with the Jimmy Fund, which is their pediatric brain tumor foundation. And so got exposed to a lot of pediatric oncology, which in some ways is similar to veterinary oncology and veterinary medicine in general, just because the patients often can't speak for themselves and have somebody else sort of advocating for them in their health. So I went to vet school at Tufts in Massachusetts, and then went on to do a rotating internship at Red Bank Veterinary Hospital in New Jersey, where I met your friend Craig Clifford, who was a great mentor to me and has continued to be a good friend of mine. And then went on to do an oncology internship with Dr. Chan Khanna in Washington, D.C. And that was really where I got my first exposure to clinical research and clinical trials, where I had some time to work with a contract research organization called Animal Clinical Investigation, to kind of learn the backside of clinical trials, learning about how those research studies get set up and all the inner workings of them, as well as treating some patients that were enrolled in clinical trials in the clinic. And then after that, I came to CSU. I spent 1 year doing a clinical trials internship, where I was sort of seeing all the patients that were enrolled in clinical trials and helping to keep all the trials organized. And then stayed on to do my residency. So did a 3-year medical oncology residency at CSU. And then after that, I stayed on and have in a position, basically a faculty position, overseeing the oncology clinical trials program.
Wow, you worked with Khanna, Clifford, and then you were at Withrow's, his
Yep.
place of his establishment, I guess. Which
Yes.
he's the godfather of veterinary oncology, or one of them. So you've worked with the best, Dr.
Yeah,
Weiser.
absolutely.
That's wonderful. I did notice that that you specifically said you decided not to work with humans instead of dogs, or you wanted to work with animals instead of humans, though. Is that, I find that interesting, especially as it pertains to your own particular health history. Are you
Mhm.
okay? How are you doing? Tell us about
I'm doing great. Yes, thank you for asking. I've been cancer free for 20 years now, which is really exciting. So
Very
I had some
exciting.
really great thank you. Yeah, had some really great connections, with my oncologist in human care and in the pediatric setting. And like I said, I had sort of considered doing human medicine. And to be honest, humans are kind of gross. And so it just didn't really sit well with me. It didn't spark my interest as much as working in veterinary medicine did. And I really, I liked the idea, sorry, I liked the idea of advocating for these animals that don't necessarily always have somebody to for them. And just being able to provide a service that, would be helpful to people as well as animals. And obviously I do, I work with people in veterinary medicine. So it's not that I don't like people. That's not.
And they're not gross.
I think I have an inkling.
I just felt that I just felt like my skills were better served in the veterinary medicine field. And that's, honestly, one of the other things that really drew me to oncology is that we get to develop really great relationships with both our pets and the clients that bring in their pets, because oftentimes we're seeing these pets every week or every couple of weeks for their chemotherapy treatments. They get to know us, we get to know them, and we really can develop these bonds with clients and helping them through really difficult times between their pets being diagnosed with cancer, deciding what treatment options to pursue. If that treatment doesn't work, deciding where to go, and then eventually oftentimes leading to euthanasia and being able to be there for them in that situation.
Yeah, I have an inkling of what you were saying, and I'm glad you said it. I was stuck when I was going the human route, but by you saying the humans gross, I think I have an inkling of what you're trying to say is that humans are messy, and sometimes I won't say the cancer is their fault, but they make lifestyle choices that that companion animals don't. It's almost like it's just completely different. I actually really like your comparison between pediatric cancer and veterinary oncology. I think that was very well stated. Well, you certainly have worked a lot of landscape out there. I left out Tufts a second ago, and that's where my first dog, Malcolm, I took him when he was diagnosed with bone cancer. We certainly have a lot of connection.
Yeah.
So I like to begin our discussion of canine cancer at the 30,000-foot level. So you've seen a lot. You've been to a lot of wonderful institutions. You worked with a number of extremely talented and gifted veterinary oncologists out there. Give us, our audience, a sense of what you're seeing, Dr. Weishaar, in terms of canine cancer out there. What are you seeing now?
That's a great question. It's the thing about canine cancer is it's very similar to cancer in people. There's so many different types of cancer. Dogs get very similar types as people do. They look the same under the microscope. They respond to the same treatment. So there's a lot of correlation between what we're seeing in dogs and in people. So, there's lots of different types of cancers that arise from a lot of different types of organs and lots of different ages and breeds. It can happen to anybody, just like in people. It can happen to puppies. It can happen to geriatric dogs, just like we see in children and in the elderly population. And so, it's interesting to see kind of how things have changed. Even, I haven't been in this profession as long as some of the other people that you've talked to. But even just in, the years that I've been involved in veterinary oncology, things have changed quite a bit as far as the treatments that we're able to do and people's willingness to treat, I think, and actually just awareness. So that's a big thing, is that, a lot of people aren't even aware that dogs get cancer, and that there are people out there like me who specialize in treating that cancer and are available to provide treatment options. And there's, a lot of the treatments that we do are very similar to what they offer for people with those types of cancer. So I think the awareness has increased a bit, in my opinion.
It really has. 15 years ago this year, I started my first walk from Austin to Boston after I lost Malcolm, and it covered 2,300 miles across 16 states. I talked to lots of people and stayed with hundreds of families. And it was amazing to me back then how many of them, the percentage, did not know about cancer in our companion animals, and that it's comparable. Basically, it's the same disease. We think of it in terms of one cancer now and just a shared ecosystem rather than canine cancer or human cancer. But I've since gone on to do 2 other walks for a total of 4,250 miles. My most recent one was after I lost Hudson just a few months ago. And I got to tell you, it was just across the state, most of the state of New York. So I also met a bunch of people, and there are still people out there that don't know dogs get cancer, but it's a lot less though. So I would say that we've done a great job in raising the alarm flag to the average pet parent out there that, hey, if you've got a large breed dog, for example, there's going to be a pretty good chance that it might get bone cancer. So you need to look out for that. If you have a golden retriever, lymphoma, if you have a Westie or Scotty, maybe bladder cancer, I think we're doing a pretty good job. But I always see as there is no water. It's not the glass is half full or half empty. There's nothing there. Is that we just need to push and do a better job for sure. But it is an exciting time, though. There are some really exciting new novel therapeutics and treatment options and diagnostic technologies out there, aren't there?
Yes, absolutely. Yeah, there's been a lot of advances that have been made, you know, in the past 15 to 20 years in veterinary medicine. You know, unfortunately, we're still leaps and bounds behind where they are in human medicine as far as treating cancer, but we're starting to get there and we're starting to catch up. You know, in the time that I've been involved in veterinary oncology, there have been 2 drugs approved by the FDA specifically for the use of treatment in cancer in dogs. You know, in the past, all the drugs that we used were human medications that we would extrapolate doses and frequencies to give to our dogs with cancer. And now we actually have 2 drugs available, commercially available on the market specifically for dogs with cancer, which is really exciting.
That is. We also have immunotherapy now as one of our tools in the toolbox, and Pet DX has OncoK9, which is doing a wonderful job on the diagnostic side. So we've accomplished a lot, we've made a lot of headway, but we're still lagged considerably.
Absolutely, a lot of ground to cover still. A lot of ways to go. We're not curing everybody by any means. You know, we're doing the best we can, but as in human medicine, there's always more bridges to cross.
And there's also, it's also important to note that there's still a lot of questions in human oncology as well. Cancer, as you know, is a very complex beast. And I do say beast in that it's living, it's organic, it grows, it evolves. That's something that most people don't understand. Most people think that the cancer is a static quantity. It doesn't. It's not. As you know, especially when it metastasizes out there. So how did you but my question is, though, with all these new tools and developments, though, are you seeing an improvement in the outcome in the typical case of cancer in dogs out there, would you say?
Well, you know, it's hard to sort of group it into just one typical case of cancer. Obviously, there's such a large spectrum of diseases with completely different treatment protocols and outcomes. You know, there are some tumors that we know can be cured with surgery alone, and that's great. And it's the ones, you know, the ones that can be more difficult, that require additional chemotherapy drugs and radiation and more aggressive therapies. And I think, you know, really what we're trying to do is to move the needle. So to make a difference to where we can extend those remission times and survival times in our pets with cancer. And it's sort of hard to take a pan-cancer approach because there's not going to be one magic bullet that's going to cure cancer, right? So it has to be something sort of individualized for treatments. And I think, you know, what I've seen, we've definitely made differences in certain types of diseases, and that's just what we're trying to do. So trying to move the needle as much as we can for pets as well as people with cancer. So finding new treatments in pets can also then lead to discoveries in humans, which is really exciting.
It was definitely a loaded question, for sure. My apologies for that, but I just kind of wanted to give people a general idea that the sense is that we are seeing an improvement in outcomes in canine cancer, broad strokes.
Sure.
Well, let's focus on your particular area of interest, and that's one of the reasons why we have you on Fuzzybutts and Friends today, and that's lymphoma. So why lymphoma? What is that particular cancer interest you or fascinate you?
I think lymphoma is an interesting cancer, first of all, because it is so common. It's one of the most common cancers that we see in dogs. And, as I mentioned, it can kind of affect anybody. So there's certainly breeds that are predisposed, but we see it in all breeds, all ages, and it can kind of manifest in a number of different ways. And one thing that I do like about it is that it's fairly easy to diagnose, so doesn't require, in most cases, doesn't require a lot of invasive diagnostics. It's not, as much of a struggle to diagnose, which is helpful for the pets and the owners because we can get them an answer quickly and get treatment started quickly. We have some treatments that are known to be effective, and they do work well for a period of time. We're often not curing our dogs with lymphoma, but we can help them to feel better, which is really helpful. We can help them to feel better really quickly. So when pets come to us and are very sick from their lymphoma, we can start them on chemotherapy and help them to feel better quickly, which is helpful for the pet as well as for the pet parent. And so I think that's one thing that I really like about it is that we can feel like in many cases have some success with treating these patients, even if it doesn't cure them. It can provide them with prolonged survival and feeling better. It's one of the cancers that we feel like we at least have some decent treatment options and can be successful treating in most cases. Certainly there's going to be those off cases that don't respond to treatment and unfortunately progress really quickly. But oftentimes we can really make a difference in those pets' lives as well as the lives of their owners. And I think there's a lot of interesting, things out there on the horizon that could potentially help our pets even more. So one of the big things that's made a really big difference in humans with cancer is the drug rituximab or Rituxan, which they started using in combination with the standard chemotherapy protocol and made a huge difference in survival for humans with lymphoma with the same disease. Unfortunately, we haven't been able to find a drug like that yet for dogs with cancer, but the thought that could be out there and could be something potentially down the line is really exciting and something we can look forward to.
Absolutely. Well, let's break down lymphoma, canine lymphoma, for our audience, if you don't mind. Let's start off with the tell us what it is and differentiate for us, please, between B cell and T cell lymphoma.
Sure. So lymphoma is a cancer of lymphocytes, which is a type of white blood cells. These white blood cells are found in the bone marrow and circulate within the blood, and then also set up in areas of the body called lymph nodes. And lymph nodes are found in all different areas of the body, all throughout all of our tissues. And these are immune fighting type of cells. So they work as part of the immune system. And there are two different types of lymphocytes, B lymphocytes and T lymphocytes. And so when lymphoma occurs, these lymphocytes become malignant and they start to divide and proliferate without any sort of anything stopping them from continuing to divide and proliferate. Usually there are mechanisms in place to tell cells when to divide and when not to. And those sort of go out the window with lymphoma. And so we tend to see these lymphocytes are released early from the bone marrow in an immature form called lymphoblasts. So they're bigger than your standard lymphocytes. And the most common way that we see lymphoma present in dogs is what's called multicentric lymphoma, which is where we see enlargements of the lymph nodes on the outside of the body as well as the inside. So most common way this is diagnosed is actually we have really astute owners that will notice like a swelling under their dog's chin that they hadn't noticed before. And they'll bring them into their veterinarian and we'll find these all over their body and can make a diagnosis that way. So that's kind of the most common presentation that we see. And as I mentioned, there are two different types of lymphocytes, the B lymphocytes and the T lymphocytes. And when lymphoma occurs, it's generally one of those two populations that proliferates and kind of goes crazy. So we can make a diagnosis using some different tests of whether it's B cell or T cell in origin. And that has some implications for prognosis. So we know that dogs with B cell do a little bit better, while T cell is a little bit tougher to treat. And so some oncologists actually have different treatment protocols for dogs with B cell versus T cell lymphoma. at CSU, we kind of treat everybody the same, but there are some different things that we can see with T-cell lymphoma, such as masses in the front portion of the chest and elevated calcium levels that we don't commonly see with B-cell lymphoma, and also different breed predispositions. So boxers, for example, are more predisposed to having T-cell lymphoma. So there can be a little bit of difference in breed predisposition as well.
Well, that was a perfect segue to my next question: is what breeds in general are mostly affected? I know I've known so many golden retrievers in my lifetime, and I know they almost always get hit with lymphoma. So what are generally what are the breeds that are predisposed to lymphoma?
So, you know, like I said, pretty much any breed can end up with lymphoma, but golden retrievers are definitely one that we see quite a bit. Like I mentioned, boxers with T-cell lymphoma, Dobermans, poodles, pretty much anything you can think of can be predisposed to lymphoma.
I have a question.
Yeah.
You mentioned that the pet parents might find the lump like in their dog's neck. Where are the other lymph nodes that the pet parents can check?
So most common places that we feel them on the outside of the body are under the chin, in front of the shoulders, and behind the knees. Sometimes they can show up kind of in the groin area or in the armpit area, but the most common places that people are finding them, you know, they're scratching their dog's neck and everything and feeling them there. That's going to be the most common place, but definitely there are multiple other locations where they can show up.
Okay. We're always telling people to check for lumps and bumps. So I want to make sure that I'm telling them to check those places as well. I'm your lumps and bumps checker person.
Great. Although and oftentimes with them, sorry, go ahead.
No, please go ahead.
Okay, I was just going to say that, you know, with lymphoma, that what's different about it is these are often symmetrical. So you're going to feel lumps, you know, under both sides of the chin, behind both knees, in front of both shoulders. Usually you'll feel it on both sides, which is a little bit different than your average, you know, lipoma or skin bump that you're going to see.
Good to know.
What is the so let's talk about the standard of care in terms of treatment. Sure. What is the standard of care? If you want to break it down, B versus T, that's fine, or go right ahead. And then also you talked briefly about prognoses, but also in terms of whether it's palliative or what break down prognoses according to the treatment, I guess.
Sure. So treatment, because this is a systemic disease, the type of treatment that we most commonly use is chemotherapy, a systemic form of chemotherapy. The standard of care treatment is a chemotherapy protocol called CHOP, which is the same standard of care that they use in people with lymphoma. It's a combination of 4 drugs, chemotherapy drugs. The drugs are Cytoxan, vincristine, doxorubicin, and then prednisone is the other drug. These drugs are given a combination of IV and orally, weekly treatments, and the protocols vary a little bit depending on the institution, but range anywhere from 15 to 25 weeks of chemotherapy. And it's sort of given in cycles. So they receive a cycle of each of those 3-4 drugs and then repeat it over and over until the end of the protocol. There's a number of different things that go into assessing prognosis or assigning prognosis for dogs with lymphoma. One of which is the B cell versus T cell, like I mentioned. Another is stage. So stage is sort of a measure of how advanced cancer is, at what stage it is in its progression. And so it's very common, like I said, to see cancer in lymph nodes all over the body. And when we see it going to other organs is when we kind of get worried about prognosis. So we can see lymphoma show up in the liver and spleen, which does not necessarily make a worse prognosis because those are considered lymphoid type organs. So they fall into sort of the lymphoid category. But it's when we see the lymphoma going into other parts of the body when we start to get worried that the prognosis might not be quite as good. And that might be things like the bone marrow. We can sometimes see it in the eyes, a number of different places. The lungs, we can see it in the lung tissue. And so that might be an indication to us that the prognosis might not be quite as good. The other thing we talk about for prognosis is what's called substage, which is a measure of whether the dog is clinically affected if they're having clinical signs related to their lymphoma. And there's a little bit of spectrum in this among veterinary oncologists. You know, the signing of a substage A, meaning not sick, versus substage B, being clinically sick, is very subjective. And I think there's a lot of variation in how veterinary oncologists interpret or assign substage A or substage B. But in general, dogs that are not feeling well as a result of their lymphoma at the time of diagnosis tend to have a bit of a worse prognosis. So as I mentioned, standard chemotherapy that we recommend is CHOP, this CHOP chemotherapy protocol, but there are other options for owners who aren't able to commit to weekly chemotherapy treatments or aren't financially able to pay for the CHOP chemotherapy, because it can definitely get quite expensive with all the treatments. So we do have some other options, one of which is single agent chemotherapy. So one of the drugs that I mentioned in the CHOP protocol, the drug doxorubicin, is that we found the most effective drug against canine cancer. It works the best out of all of our chemotherapy drugs. So if we're going to do treatment with a single agent, we recommend using doxorubicin. And so that drug is given generally once every 3 weeks for 5 treatments. So it doesn't require as many visits, not going to be as much of a financial commitment, but the prognosis is not going to be quite as good as it would be with treating with a multi-agent protocol. So the benefit of using multiple different cancer drugs that have multiple different mechanisms of action is that it can fight the cancer in multiple different ways and beat down those cancer cells that, you know, may be resistant to one drug, but then sensitive to a different drug. So if we're just using a single chemotherapy agent, the cancer cells are smart and they're going to become resistant to that drug more quickly than a multi-agent protocol. And so that's why our survival times and remission durations aren't going to be quite as long. Another option is just to do prednisone alone. So prednisone is a steroid, but it actually does have some anti-cancer effects against the cancerous lymphoblasts. And so we can see dogs actually have some shrinkage of their lymph nodes on prednisone, and it can also just help them feel a little bit better too. But unfortunately, that doesn't last quite as long, and the survival with just prednisone alone is generally quite short.
I like to, let's summarize it. That's a lot of data, a lot of great data. I'm a data guy. I love data a lot, but let's kind of condense that for our audience. So if a dog comes into your clinic and presents with malaise, swollen lymph, and clearly not feeling well, and the pet parent chooses no treatment, typically what are we looking at in terms of a prognosis?
So with no treatment at all, survival is going to be quite short. So generally weeks to up to a couple months at the most. Okay. If we add on prednisone to that, it doesn't necessarily extend survival, but can help the dogs to feel better for a period of time. So survival may be a little bit longer just because they're feeling a little bit better for a little bit longer. But unfortunately, survival is quite short. So median survival with no treatment is 2 to 3 months.
And what is it with CHOP generally?
So with CHOP chemotherapy, we give our times in median survivals, median being 50% of dogs do better, 50% of dogs do worse. And that survival is usually in the range of about 10 to 12 months. And so what that means is that it varies a bit because we'll start some sort of treatment protocol, and then at some point, usually they will fail that protocol, so come out of remission. And then there are other treatment protocols that we can try down the line to try to put them back into remission again. But eventually it just gets to the point where the disease is no longer responding to any of our treatments. And at that point, owners will make a decision to let their pets go.
Yeah, I think it's important because I just can't reiterate enough to pet parents when they think about quality of life and prognosis. Mm-hmm. That we humans tend to think in terms of months, but with CHOP protocol, if you can get 12 months with your Fuzzybutt, you know, you think, well, 12 months, a year, boy, that's not a lot. Well, if your dog lives 10 years, be 10 years, that's 10% of a lifetime. And I don't know anybody who wouldn't pay whatever to get 10% more life. I'm getting a little older, and I'm already squirreling that 10% of that money away so I can get 10 more percent. So it is important for people to realize, I know there are financial considerations out there for everyone, but it's worth an investment. And I also want to use this moment to also reinforce the idea of going to see a board certified veterinary oncologist. Your general practitioner may be great, you may have a great diagnostician, but the person to go see for your particular fuzzy butt is a board certified veterinary oncologist. What about, so
sorry, can I just add two things
please.
Really quickly to that? I'm sorry, I don't want to interrupt you, but one of the things, so two things briefly. First of all, chemotherapy in pets is very different than chemotherapy in humans. And I think that's something that's really important for pet parents to know. So when you think about chemotherapy in people, you think about how sick people get and how miserable they are. And that's because, you know, they are trying to treat the cancer in the humans as aggressively as possible in order to have that person survive as long as possible. That's not our goal in veterinary medicine. Really, our goal is quality of life. So these dogs don't know why they're getting sick from the chemotherapy. They don't know why we're giving them this treatment. They don't know that they have cancer. And so really, we want to maintain their quality of life while also providing a treatment for them. So the side effects that we see in our dogs with cancer that receive chemotherapy are not nearly as significant as what they see in people with cancer. And so I want people to be aware of that, because I know chemotherapy is a very scary word and people have a lot of preconceived notions about what chemotherapy is like. And it's important to know that that's not what we're doing in these dogs with cancer, is we want them to be feeling well while they're going through treatment. And if they're not tolerating their chemotherapy treatments, we can adjust the doses to get it to a point where they can tolerate it, or we can stop. You know, that by no means are people locked into going through the entire chemotherapy protocol without having the option to stop. The other thing that I wanted to mention, as you mentioned, Luke, about going to a board certified oncologist versus your regular veterinarian, and you know, it's amazing the things that general practitioners can do. And I think one of the important things to know is we mentioned prednisone as a treatment option for by itself for lymphoma. And sometimes what people will do is start their dogs on prednisone while they're sort of thinking about what they might want to do as far as chemotherapy. And that can actually cause the chemotherapy drugs to be less effective if the dogs are on prednisone for a long period of time prior to starting chemotherapy. So we generally don't recommend starting prednisone for a dog who's just been diagnosed with lymphoma as long as they're feeling well. If they are feeling poorly, then that might be a time to consider starting prednisone to kind of hold them over if they're not going to start chemotherapy treatment right away, you know, if you're not able to get into it with an oncologist very quickly. But we don't know, unfortunately, we don't know the exact length of time. You know, we can't say that if you're on prednisone for this exact period of time, then the chemotherapy is not going to be as effective. But we generally recommend that pets not receive prednisone for longer than 2 weeks before starting chemotherapy.
Those are.
I want to mention back about the chemotherapy. My dog Lily she was on Palladia for some stomach cancer. The first time she had stomach cancer, we didn't do any chemotherapy. The second time she was on Palladia, which is not any of the drugs that you mentioned. So I don't know how those would have affected her, but in the beginning, we did have to adjust the dosage because she was having some loose stool. But after that, she was on it 3 times a week for a year. And she's cancer-free. She just celebrated her 15th birthday. So, but she had no real issues with it at all, except for maybe her hematocrit was a little low. And I think we had decided that that may have been one of the side effects from Palladia. It may not have been, but it did go up once she was off the drug for a few months. But she didn't lose her hair. She wasn't sick. She was as sassy as ever, bossing everybody in the house around, including me. So, you know, I know people are afraid because they think their dog's going to go bald or throw up
Yeah.
all the time. So I'm glad that
Yeah.
you mentioned that.
Yeah, you just proved the point why the pet parents should go get a consult with the board certified veterinary oncologist, because those are two great additions to the conversation that we tend to think about what's the tolerable dose and quality of life and treatment. Great points. You mentioned also a while back when we're discussing treatment options for canine lymphoma, Rituxan. Let's talk about that. Is that not that's not available in dogs, correct? Is there?
It is not. So Rituxan is it's a type of drug called a monoclonal antibody that targets a specific marker on human B lymphocytes. So it's only used in people with B cell lymphoma. And that drug specifically targets human B cells. So it doesn't work in canine B cells. It does not recognize canine B cells. And there's been some attempts to try to make a similar type of drug that targets canine B cells, as well as one that targets canine T cells, to try using T cell lymphoma. But unfortunately, those drugs have not yet been successful in canine oncology. But it's definitely something that, if we could find something like that, would be really great, and could, and it, like I said, it really changed the way that they treat lymphoma in people. And so it'd be great if we could find something like that for dogs.
So we don't understand what the problem is, other than the fact that we're not cloning antibodies in the canine population right now. Is that
it's just so the drugs that they designed to try to mimic the action of rituximab in human B cells have not been effective against the canine B cells as of yet.
Are there any other new treatment options on the horizon, Dr. Weishaar, that are promising, that you're optimistic about?
So, there's a number of different things. As I mentioned, I didn't specifically mention, but one of the new drugs that was approved for use in dogs with veterinary medicine is a drug for dogs with lymphoma specifically. So it's a drug called Tanovea, which is an injectable chemotherapy drug. And it has a completely different mechanism of action from any of the other chemotherapy drugs that we use in dogs. And so it provides sort of a unique option, a different way of targeting those cancer cells. And so that is something that is commercially available. There's been multiple studies, many of them done at CSU in using this drug in dogs with lymphoma. And we're really excited about the perspective of using that in a number of different diseases for dogs, as well as potentially in cats with lymphoma, maybe an option as well.
Excellent. Well, you also have another area of interest that I wanted to get to as well. I don't want to cut our conversation short about canine lymphoma, but if you have anything else you want to add to that, please go ahead. But you also have an interest in mast cell tumor, and I lost my most recent dog, my Fuzzybutt Hudson, to metastatic mast cell disease. And so thank you very much. He was a 10-year survivor. We started pulling off mast cells when he was pretty young. I think he was 1 or 2, I think was when we figured out that was when we started picking them off of him. So if you look at it from that lens, that he was a 10-year cancer survivor, then it was a fairly good outcome. And he lived to 15. But the last, at the tail end, it became catastrophic. So it was a tough loss. So talk to our audience about mast cell tumors, mast cell cancer. Tell us about that.
Sure. So mast cell tumors are a little bit unique in that this is not something that we see very much in humans. They sort of get a different version of mast cell cancer, but it's quite different from what we see in dogs. So mast cell tumors are the most common cutaneous or skin tumor that we see in dogs. They make up about 20% of skin tumors that are found. And mast cell tumors are very frustrating for a number of reasons. First of all, they can kind of look like anything on the skin. They don't necessarily have a specific appearance that, you can look at them and say, oh, that's a mast cell tumor versus something else. We call them the great pretender because they can look very benign, sort of like a fatty mass that you might see, or they can be very ugly and aggressive and ulcerated and swollen and things like that. So they can present in a number of different ways. And their behavior is also quite variable. So some of them are very low grade and it can be cured with surgery alone. And then some of them behave really aggressively. They can grow back after surgery. They can spread usually to local lymph nodes or to the liver and the spleen, and can be very difficult to treat when they get to that point. And it can sometimes be hard to tell who's going to be a bad behavior and who's going to be more benign. The other thing that we struggle with is that once a dog has one mast cell tumor, they are then predisposed to getting more mast cell tumors. And so we end up with these dogs that just, keep getting multiple mast cell tumors, and it gets to the point, you can keep taking them off surgically, but sometimes it gets to the point where, that's not an option anymore if there's just so many of them. And those can be really tough situations to treat as well.
Yeah, I want to go back to something you're saying, but there are genetic tests out there that look at the markers for mast cell tumors that give us a good idea about the mitotic index. Gives us a better idea of what we're looking at, though, right?
Yes, absolutely. So one of the biggest tools is our biopsies. So when we have a mass removed, we submit those for histopathology for a pathologist to look at under the microscope. And there's grading schemes that can be used to tell us, based on the microscopic features, whether we think it's more likely to be a more benign tumor or a more aggressive tumor. And one of those things that you mentioned is mitotic index, which is basically a measure of how much the cells are dividing, how often they're dividing. And so if we see a tumor that has a really high mitotic index, there's a lot of replicating cells, that's an indicator that it's going to be a more aggressive type of mast cell. There are also some other features that we look at under the microscope that can give us that idea, and then can kind of separate that into high grade and low grade. There are also some other tests that are out there looking at other indications of how much the cells are proliferating that can sometimes be of assistance as well. But really the mitotic index is the one that's proved to be the most significant for that type of marker, and then just really looking at the grade. And it's a little bit easier now with the grading system that we have. In the past, the sort of the original grading scheme for mast cell tumors was called the patent grading scheme, and it was a 3-scale grading scheme, so grade 1, grade 2, or grade 3. And it kind of separated out in that grade 1 tumors were generally benign, didn't really need to do much more than surgery. Grade 3 tumors are going to be your bad actors. They're going to be aggressive. You're going to want to follow with some sort of systemic therapy, chemotherapy to try to prevent them from spreading. But then the grade 2 tumors were sort of this amorphous population where some of them would be benign and behave more like a grade 1 tumor, and some of them would be more aggressive and behave more like a grade 3 tumor. But there really wasn't a great way to separate those out. We now have a different grading scheme that really it has 2 categories, a high grade and a low grade, based on the features that they see under the microscope. So that can give us a bit more information, makes it a little bit easier for us to make treatment recommendations for owners, whether they should consider some sort of chemotherapy, or if we're okay just kind of watching and waiting and seeing what happens.
And it did for me. It made it easier for me, and that's why I brought it up. And it's important for pet parents to know is that if you look at that because I'm one of those pet parents, as soon as there's cancer, I'm like, get it off. Let's treat it with everything. Let's throw the full arsenal, call out all 4 branches of the military, whatever we've got to do, get surgical oncologists, medical oncologists, get them all in here. Let's figure out what to do to take care of this. But fortunately, Craig Clifford, actually, speaking of earlier, he was the one that that first introduced me to the additional testings for the mast cell tumors. And that was critical for me in my thinking, because we excised it, removed it, which you do with so many of the mast cell tumors. But the question was, do we follow it on with chemotherapy? And because the additional diagnostics revealed, no, this is really probably a slow-growing, non-aggressive type mast cell tumor. For the entirety of the 10 years, Hudson never had chemotherapy, just remove the tumor, move on to the next one. Hopefully it's not for another couple of years. But think about it differently. If I had made the choice differently and I treated Hudson all those times with chemo, just think how it would have wrecked his body, and would he have lived to 15? So That's why I bring it up. It's important, pet parents, for you to do the additional diagnostics and your biopsy and get as much data as you can about the tumor, the exact cancer you're looking at, because it really does affect treatment options, right?
Absolutely. Absolutely. Yeah.
And you know,
I have a question. Yeah. So
Yeah.
are mast cell tumors always found on the skin, or are they sometimes found internally?
That's a great question. Most of the time they are found on the skin, at least as the primary tumor. We can see what we call visceral mast cell tumors, which occur sort of in the abdomen. So in the liver and spleen is the most common place for those to show up. But like I mentioned, that's a place where the tumors can spread to. So it's less common, but it can occur. We do see that sometimes in cats. Cats are strange beings. They are not small dogs and they're not small people by any means. And so they do get mast cell disease, but it's a bit different from what we see in dogs. Oftentimes it will be internal or multiple small masses sort of on their head and neck area. So it can be a little bit different.
But cats are definitely not humans. Cats are definitely not dogs, but they are Fuzzybutts. And we do talk about them here on Fuzzybutts and Friends. So it was a great question. And I did not know that cats got mast cell tumors. That's my first time I ever heard of that.
Yeah.
Fairly treatable then, for the most part, like in their canine model.
So it's a little bit different. The ones that show up sort of on their head and neck tend to be pretty benign. When they get those visceral mast cell tumors, though, those can be quite aggressive and require extensive treatment.
Great. Well, let's move on to the next question I have about mast cell cancer then, Dr. Weishaar. Is it across the board with breeds, or are there specific types of breeds that are specifically more affected by them?
Sure. So again, can happen in any breed, any age, any sex, any weight, anything, just as in people. But we certainly do see breeds that are more predisposed. So what I like to call smushy face dogs, so our boxers, our French bulldogs, our pugs, those tend to be predisposed to developing mast cell tumors. In most cases, not all, but most of those tend to be more benign, so the less aggressive mast cell tumors, but they can be predisposed to getting multiple different mast cell tumors and also can be more aggressive. Shar-Peis are another breed that are predisposed to mast cell tumors, and they are predisposed to, unfortunately, the more aggressive type. And so their mast cell tumors can often be very bad with a high rate of spread and unfortunately not a great prognosis. But again, can happen in anyone, anytime, anywhere.
That's interesting. It's the wrinkly dogs, though, the smudgy face dogs, though, because they have a different skin, as texture to the skin as other canines, and it can't help but ask the question: is there a correlation between the two? I'm guessing we have no idea.
Unknown, right? Yeah, it's unknown why those specific types of breeds are more predisposed to mast cell tumors compared to others. It may be some sort of genetic predisposition. Maybe something in their skin, as you mentioned. It's unknown, but it's an interesting question.
Also, an interesting question, which that's been met with the same response, is the link between allergies, very hyper allergic dogs, and mast cell tumors. Because my Hudson, and also many other Fuzzybutts that I've met and pet parents I've talked to, is that have had mast cell cancer. They've had very allergic dogs. So do we just think there's a correlation, or we have some sort of better idea?
No data that I know of to show a correlation between allergies and the development of mast cell tumors. But again, it's one of those things that maybe with some more investigation, we might find some sort of a link. Mast cells are cells that are associated with allergic skin disease and just in skin disease in general. So, for people who don't know, mast cells are kind of the cells that are involved in any kind of allergic reaction or insect bite or bee sting, anything like that. So when you get stung by a bee or bit by an insect and your skin gets all swollen and red, that's all because of mast cells that are drawn to that area, and they have these granules inside them that contain all these sort of inflammatory molecules, and so they release all those molecules that cause this inflammation, and they have histamine in them as well, which is what makes them really itchy. So oftentimes, dogs with mast cell tumors, the mast cell tumors will be itchy because they'll release histamine. It can also sort of swell and shrink is one thing that you'll see with these skin tumors, because if those mast cells sort of release their granules and blow up and inflame, they can get sort of swollen and red. And then once those calm down, it can kind of shrink down and go back to normal. So they're very interesting tumors.
Now, are they treated with any type of antihistamine?
Yeah, so oftentimes, you know, if a dog has a mast cell tumor on their skin or somewhere in their body, we will put them on an antihistamine, usually Benadryl, and then also some sort of GI protectant, just because those some of the mediators that they release can cause some irritation to the GI tract, and so we'll try to avoid those things. Okay. If we've done surgery to remove the mast cell tumor and then are following with some sort of treatment or just monitoring, then we don't necessarily recommend putting them on those because they shouldn't have any mast cells from their tumor in there.
Okay.
And mast cell cancer is a little bit different than lymphoma. It's much harder to pinpoint a prognosis because of all the different sizes and variations of the tumor cells. But generally, I guess when mast cell tumors metastasize, they metastasize to organs, correct? Are there any particular organs that they target?
So local lymph nodes are the most common place that they go to first. So whenever we have a dog with a mast cell tumor, we're very careful about feeling their lymph nodes, the local lymph nodes in the area. And oftentimes it is recommended that if you're doing surgery to remove a mast cell tumor, to remove that local lymph node at the same time to see if there's any evidence of cancer cells in that lymph node. Sometimes if they feel completely normal, you can try to get some needle aspirates ahead of time to try to determine if there's any cancer in there. But oftentimes taking the lymph node out and looking at it under the microscope is really the best way to determine that. Again, because mast cell tumors can be really tricky, sometimes it's sort of hard to even diagnose whether it's true lymph node metastasis or not after a biopsy, because there can be normal mast cells within a lymph node, and we can also see if the mast cell tumor is draining to that lymph node, there can be an increased population. But there are certain characteristics of the lymph nodes that the pathologist will look at under the microscope to tell them whether they think the lymph node is truly metastatic, it's truly spread there. And that can give us some more information about treatment recommendations and prognosis. So after lymph nodes, the most common location for mast cell tumors to go is to the liver and spleen. So they're a little bit different than other cancers that we think about normally spreading to the lungs. That's not necessarily the normal course for mast cell tumors. So if we have a dog that we know has a high grade or aggressive mast cell tumor, we're going to recommend, evaluating the local lymph node really closely, and then also doing an abdominal ultrasound to evaluate the liver and spleen to make sure we don't have any evidence there as well.
So let me go back to something that you mentioned earlier, because I just wanted to stress this to people. So as you had said, that the lumps and bumps, you can't tell by looking at a lump on a dog, or lump or bump, whatever you want to call it, whether or not it's a lipoma, like a fatty tissue, or whether it is a mast cell tumor. I hear people all the time. Oh, exactly. Could be anything. But I hear, for some reason, when I'm petting a stranger's dog, I find every lump and bump on them. And I'll say, do you know your dog has a lump here? And I often get, yeah, my veterinarian said it was just a fatty tumor. And I would say, so did they do a needle aspirate? No, they just told me to wait and watch it. I always want to know, what are you waiting for? To do a needle aspirate is a pretty inexpensive way to diagnose whether it's a fatty tissue or whether it's a mast cell tumor or whether it's a whole host of other things. So I just wanted to stress that your veterinarian cannot tell without doing a needle aspirate, correct?
Yeah, that's a very great point. And, sometimes, we use our best guesses as to what we feel when we're doing an exam on a dog. And, we can say this really feels like a lipoma. And if the owners choose not to do any additional diagnostics at that time, we'll recommend, like you said, just monitoring it. And if it changes, if it starts to change in its appearance or starts to grow really quickly, those are signs that it's maybe something more malicious that should be checked out again.
Okay.
So to summarize and recap all that is, as soon as you feel a lump or a bump on your fuzzy butt, take them to your GP to do a needle aspirate, because the GP should be, your veterinarian should be able to look at those cells underneath a microscope and determine whether they're normal looking or what one of my former vets used to call them, those are crazy cells. We got to have them looked at. And as Ginger mentioned, it's not obviously a very invasive or expensive procedure. And so if it does come back, obviously, as crazy cells or mast cell tumors, then you just excise it or remove the tumor and get as much clean margins as you possibly can. So that's the treatment of mostly all mast cell tumors. So the question for the pet parent becomes then when to chemo, when to do further treatment.
Yeah, so that's a great question. And there's a number of different factors that will go into the decision as to whether or not we recommend chemotherapy. The first, like I mentioned, is how it looks under the microscope, whether the pathologist classifies it as a high grade or a low grade, and depending on some of those microscopic features under the microscope. The second will be the evaluation of the lymph node. So if we see if we're concerned that there may already be spread to the lymph node, that's another reason to consider pursuing chemotherapy. Or if we have evidence of spread of the cancer somewhere else in the body. So like I mentioned, in the liver, spleen, or some other lymph node somewhere else. So those are the main criteria that we use to determine whether or not we should follow with chemotherapy.
And if you do, what is the standard of care typically?
The standard treatment that we use is a drug called vinblastine. There's a number of sort of different protocols of how people give the treatment, but usually it's about weekly or every other week treatments for up to 8 treatments if we're treating in the setting of microscopic disease or after surgery. That's kind of our standard. There are other chemotherapy treatments available. So lomustine or CCNU is another drug that's used for dogs with mast cell tumor. And the drug Palladia that you mentioned, Ginger, is actually, that drug was specifically approved for dogs with mast cell tumors, but is used in other types of cancer as well. There are other treatment modalities that can come into play in the treatment of mast cell tumors besides chemotherapy. So sometimes like you mentioned, we want to get good margins around that mast cell tumor, because generally what we see on the surface is not the entire what we see of the tumor. There's tumor cells outside just the tumor that we see on the skin. And so we try to take what we call wide margins around the tumor to try to get all those tumor cells. But sometimes we aren't able to get clean margins because of where the tumor is located. So if it's located, for example, on the leg, down at the bottom of the leg, there's not a lot of extra skin there to be able to take off in order to be able to close the incision. So we might leave mast cells behind, which is something that they'll look at on the biopsy report when they look at the histopathology. So in order to try to get rid of those cancer cells at the surgery site, we might recommend radiation therapy. So radiation treatment specifically to the scar after surgery, to sort of what we call clean up margins, to get rid of those remaining mast cells. Radiation can also come into play if we have a mast cell tumor that is not able to be removed surgically at all. So if it's in a location where surgery is not possible, or if it's too large to be able to be considered reasonable for surgery, or if we already know that we have spread to internal organs. So if we already know that we have spread to internal organs, then removing that primary mast cell tumor is likely not really going to have much of a benefit for the dog. So radiation can be used in treating what we call gross mast cell disease, and mast cell tumors do tend to be very responsive to radiation, so we can see those shrink quite well. And we've actually had quite a bit of success with a combination of radiation therapy and the drug Palladia, where we've seen dogs with gross mast cell disease have their tumors shrink and really respond quite well to that type of therapy. So it's oftentimes a multimodality therapy. It's not just one thing that we're using to treat these pets with mast cell tumors, and it's really depending on that specific pet and what their disease status is, and also what their owners are able and willing to do.
I just realized that that it's interesting. Most of the mast cell tumors, mast cell cancer, is treated by the surgical oncologist rather than medical oncologist, which makes it's curious to me that that's one of the types of cancers that you're interested in, because you typically consult then on later stage cases, right? Cases downstream that are the outcome is not that favorable or less favorable looking.
Sure. So that's, the ones that are removed that are low grade and remove with surgery, those are the easy ones, right? So those are the ones we don't have to worry about. It's these ones that, are more aggressive, that, can really be difficult to treat. And also that situation, kind of like I mentioned earlier, where, dogs just kind of get so many mast cell tumors that they can't be removed surgically. It's just not feasible to be able to remove them. And when surgery is not an option, that's kind of where we, as the medical oncologists, come in. And things are, the way we work at CSU, we have sort of this integrated service where medical oncology, radiation oncology, and surgical oncology all work together. So it's a really great environment because, we're seeing these low-grade mast cell tumors that are coming in, and, we're consulting with the surgeries and working together to make sure that the treatment plan is appropriate. And so, if a surgeon cuts off a mast cell tumor and a biopsy comes back and we say, oh, this is looking like it's a more aggressive one, let's get our medical oncology team involved and see what we can do treatment wise. So we're really lucky in that way to sort of have this integrated service where we all work together.
Yeah, yes, you do. I like what you said about, you kind of said, mast cell, the cases I see are the messy cases, basically the complicated ones, which the way having one of my own Fuzzybutts, a 10-year survivor of mast cell cancer, the way I thought about it is it's the best cancer to get until it's not. Because if it's not, you have multiple tumors, you have, it becomes a very complicated, messy case, which was the case with Hudson, and it cascaded down too quickly for him to respond to chemo. There's so much data, so much wonderful information for pet parents out there. I knew it was going to be ambitious for us to try to fit in 2 different types of canine cancers, but you did a wonderful job, Dr. Weishaar. And but we're running long, so there are a couple of bullet points I wanted to get to, but we're not going to have time to this episode. Perhaps we'll have you on a Fuzzybutts and Friends again. So where I would like for you to leave it with is that, do you have any final messages to pet parents that get the initial diagnosis of either cancer or lymphoma or mast cell tumors? So something you'd like to say to the audience?
I just want to say that, we're out here to help you. We are the entire medical oncology community. All we want is what's best for you and for your pet. And I think it's really important, like you mentioned, Luke, to have that initial conversation with an oncologist, just to know what options are out there. Even if you think there's no way that you're going to pursue any treatment and you're not going to do anything, just have that conversation so you know what's out there. And, as I sort of mentioned earlier, one of my passions and really my focus is clinical trials and clinical research. So trying to find new treatments, both for pets and people with cancer. So even if there's not necessarily a treatment out there that you think you want to pursue for your pet, there may be a clinical trial out there that you could enroll your pet into that could, even if it's not going to help your pet, could help pets and potentially people in the future. So kind of thinking about all the options that are out there, exploring your options, talking to a medical oncologist, talking to your regular veterinarian as well, trying to figure out what your options are, and really just making sure that you have all the information to be able to make an informed decision.
Absolutely.
Is there a place where the pet parent can go and look to find all the clinical trials that are going on?
The AVMA hosts a searchable online database of veterinary clinical trials for all conditions, not just for cancer. Unfortunately, it's not comprehensive, so it's not like clinicaltrials.gov like they have in people, where every clinical trial has to be registered on that website. But they're sort of trying to imitate that, in that it's a searchable database, but it sort of relies on the people who are conducting the studies to enter their information on there. So all of the clinical trials that we have for oncology at CSU are listed on that website. But, think about, you can ask your oncologist look at if you have a veterinary school in the area close to you, going to their website and looking up clinical trials, that can be a really good way to find those. But unfortunately, there's not something quite as comprehensive as clinicaltrials.gov. But that's the dream, right? So maybe someday.
Absolutely. You said a second ago, kind of a corollary to that about wanting to help pet parents, and that's why you're there. And absolutely correct is that the more data you have, the better the medical decision that you're going to make on behalf of your Fuzzybutts. But another way that you can help, Dr. Weishaar, pet parents, is getting pet parents to board certified veterinary oncologists, and that can mainly be done by getting more veterinary oncologists out there. I talk to anybody who will listen to me in the community. We need more board certified veterinary oncologists out there because the population last time I checked was in the 500s, and some pet parents have to drive 5 or 6 hours. So that's the main pushback, or that's the gap. That's the chasm between better adoption amongst pet parents, to seeing more pet parents out there, patients out there. And it's a message I try to get across to the veterinary oncology community. Craig, Phil, all the guys, is they're tired of hearing me talk about it. But as you know, and the most important thing about that is that time is of the essence, because as you know, by the time the dog, your Fuzzybutt, presents with cancer, in most nearly all cases, it's pretty advanced. Or at least it's established. And so it's an uphill battle when you're looking at treatment options. So if you could do anything for pet parents on our behalf, is next time you're at what is the conference, Ginger? I can't believe I just forgot the name of the conference.
The ACVIM?
No, the
VCS.
VCS, thank you. So many acronyms out there. Next time you're at VCS, make sure you tell everybody, hey, we need to get more oncologists out there for pet parents. All right, I think that's we had a lot of information. We covered a lot of topics. Ginger, did I miss anything or screw anything up this time?
Not this time, I don't think. And typically I have cancer tips, but I think we've covered all those. Have all lumps and bumps checked out.
I think that's why she makes me do most of the talking, is that I'm the one that's going to screw up. If anybody statistically is going to screw up, it's going to be me. All right. Well, since we typically at this point of the podcast, we have a cancer tip of the week provided by the Puppy Up Foundation. But since we've been talking about cancer the entire episode, we'll defer that till the next episode. Dr. Weishaar, thank you so much for being on Fuzzybutts and Friends. Since you're involved in clinical trials, I know we looked at one of your studies, the foundation. We fund research. Given the pandemic, it's been a tough couple of years, so we haven't been funding any new research yet, but we certainly are going to be so. And I certainly hope to look at some of the studies and research that you're looking to do as a PI. So thank you for doing that. We can't get enough research funds out there. We can't get enough studies, and there certainly is not enough money. That $20 million from NIH was great, but that's not even a rounding error when it comes to human oncology. So thank you for everything you do, Dr. Weishaar. And it's been an honor having you here. And you're always welcome back as a friend of the Fuzzybutts. You're always welcome back on the show.
Thank you very much. And thank you very much for having me on and for doing all that you're doing to get awareness out there about cancer and all the other diseases in pets. We really appreciate it.
Absolutely. Thank you very much. I appreciate that. We really do. Ginger too. She works really hard. All right, guys, that wraps up this episode of Fuzzybutts and Friends. You can find us. New episode drops every Tuesday. We try to get it at midnight Eastern Standard Time, but that's me that's dropping those, so I'm not always 100%, but I try to get as close as possible. You can find it available on your podcast platforms like Spotify and iHeartRadio, or you can go to our YouTube channel, which is fuzzybutstudios.com. We'll talk to you next week. Puppy up. Talk soon.